Dr. Shirley Putman Toney. I had been employed at Gardner-Webb since 1965 when we started the Associate Degree Nursing program here at Gardner-Webb Junior College. And have worked here actually a total of 41 years, retired last time 2008. I was a full professor and the first dean of the School of Nursing. From the time I was 10 until I was 25, I felt that God was calling me to be a missionary nurse, and everything I did prepared me for that. And then I went to Southwestern Seminary with my roommate and another friend, and we worked at our first RN job at Harris Hospital in Fort Worth. And we decided that God was not calling us anymore to be nurses, missionary nurses. So we came home. Then I started dating my husband, who was in the car dealer. He was a car dealer at that time. And this is funny, and I think it's interesting. He knew Eddie Lee. Eddie Lee was the only son of the widow, Mrs. Grace Lee, who was the director of the nursing program at Rutherford Hospital School of Nursing, which had been there since 1906. And they needed a nurse educator. Anyway, Eddie and my husband Max got to talking, and Max said, well, my wife's a nurse. We had only been married about a year and a half. Eddie went home and told his mother, Max's wife is a nurse. She said, get her up here. I went and interviewed with Mrs. Grace Lee, and that was my first job as a nurse educator, where I stayed 2 years until we started here. But what I think's funny, do you know I got a nursing education because of 2 car dealers? I think that's funny. That's exactly how I got into nursing education. We all saw the handwriting on the wall. We were thinking that nursing education should be in institutions of higher learning. And so she started getting us, our students down here for anatomy and physiology, and that's the reason anatomy is taught at Gardner-Webb at this time. Mrs. Lee got that started because our students needed it. Our students drove a Volkswagen van down here 3 days a week to take anatomy and psychology and English. And so that got that group of diploma students into college. So when I was there 2 years, and Mrs. Lee, we all worked with Cleveland Memorial Hospital and Rutherford Hospital and Gardner-Webb Junior College, Dr. Poston. And everybody was excited about bringing nursing to Gardner-Webb Junior College. We worked for about 2 or 3 years. We had met many committees with some of their boards of trustees. They actually decided they were going to give us several $1,000s for a few years to help us get started. So it was a joint effort between the 3 institutions. And because of Mrs. Lee's vision, because we decided nursing should be in a college. So here we are, Glennie, and Glennie's a Presbyterian Queens graduate, just got out of school. Glennie and I are the 2 instructors, and we'd made up the syllabi on my Royal portable typewriter on onion skin paper, and all the students did not receive syllabi at that time like they do now. But we met, there are 43, 44 students. We met in the microbiology lab in the science building, and we defied fire codes because that room was made for like 20-something people. They had those stools that people sat, if you remember. And we had the hospital, the Rutherford Hospital iron bed, and then the hospital gave us some old medications that were out of date, different things, so we could teach students how to do injections and how to pour pills. And we had the one mannequin, Miss Chase. Glennie and I, they had no office for us, But so Gardner-Webb put us in the closet, skinny closet about as wide as these tables, next door to them. It was a closet. And they put a long table in there for us and a chair, and when we wanted to go past each other, we had to pull in like this. Eventually we got into Elliott Hall, and then of course we started here. The first place we had here in this building, we got what had been the operating room and the emergency room. Gardner-Webb was able to get that, and we used that for a lab. That was the very first thing we ever used in this building. And I was delighted to see that later that Gardner-Webb bought the entire thing and turned it into what it is now, which is wonderful. Well, for one thing, associate degree nursing programs were brand new. And by the way, this ADN program was the first in North Carolina out of probably 70 or so now. None of us really knew that much. Now, Mrs. Lee and the two hospital administrators had made some trips to Milwaukee, to Florida, where there were some programs, and they had learned. Mildred Montague is the person that came up with the concept of the 2-year program as opposed to the 3-year, and the baccalaureate programs were very few at that time. Mildred Montague was a teacher at Teachers College at Columbia University. She's the one who came up with the concept of the associate degree program. She said, you don't need to stay in the hospital 3 years and to do the same thing over and over and over. Once you learn to do a good bed bath and a good bed and some of these things, you don't need to keep repeating this over and over and over. And so she streamlined it and put it in colleges for 2 years. So we just met all these problems as they came. And we learned who we were, and everybody else learned who we were and what we were supposed to be doing. And as the students started graduating after 2 years, they started taking care of Gardner-Webb faculty in the hospitals. And we would hear all the time, somebody would say, I had such and such a student as my nurse, and she gave me great care. So gradually, we have come to where we are now. We went along, we kept up with the things that were going on in the country, with the needs. We were always affiliated with our professional associations and the National League for Nursing, the Board of Nursing. We kept up with things that were going on. We went to meetings, we were members of the professional organizations, and we wanted to be as up to date. We wanted to meet the needs of people, whatever they were. As health care changed, health care has gone a long way. Do you know when we first started, even when I was in nursing school, we could not tell patients what their medicines were. We could not tell them what their blood pressure was. Even when we started at Gardner-Webb, if a patient said, what's this medication for? And I would have to tell the students, I said, you can tell them it's for your blood pressure, but you can't tell them the name of it. Well, we all know now, you can go online, you can go to your doctor and say, I want this medicine, and you get it, right? Things have changed. As we've given people more credit for being smart, it's helped the people to take care of themselves better. And that's another thing. We've learned that people don't all have to be in the hospital. We've learned that people can take care of themselves out of the hospital. It cuts down on costs, it gives them more autonomy. So nursing has been right along with this, and the nurse practitioners and we've got the program here. The nurse practitioners have shown that they can help to supplement where physicians are not available or can't. Smart nurse practitioners they can fill in these gaps. We've had caring faculty and students, and we've had a presence on this campus. We won everybody over, I think. We won not only the people here at Gardner-Webb, we won the community, we won this whole region. People know Gardner-Webb. They know the nursing students. They know not only the reputation of the School of Nursing, but also the reputation of Gardner-Webb. I think God has been good to us and granted us this opportunity. And when I think of what I've been able to do, I think it's an opportunity that I'm very grateful for.